Well, are you ready to sign up for Medicare and get going? Well, if you are in the right place. My name is John Gregory Downing. I go by Greg Downing. I am a Medicare agent here at Texas Medicare Advisors, along with Rochelle Abbott. She is my partner in crime here. We're both licensed insurance agents specializing in helping individuals sign up for Medicare and get the right Medicare plans at the right place. So, our job is mainly educators to help you walk through this process. Now, you might say, well, good golly, I wonder how much this costs. It's got to be expensive. Well, that's the good news. Our service is free. That's right, because we are compensated by the insurance companies to help you find the plan and the program that fits you and your budget. So that's what we're going to do. Now, if you're like most people, the more you read, the more confused you get. I mean, there's so many things that say if, maybe, might, and but that it just gets really confusing. Our job is to make sure all this makes sense to you and it is as clear and as simple as possible. So what I'm going to do right now is just share with you what I would do if I was signing up for Medicare today, as I've helped many of my friends and family members and clients do to get the right plan at the right price. Now, no matter what you do, you've got to have two parts of Medicare. The first part is Medicare Part A. The second is Medicare Part B. You have to have both of these. Let's take a look at what is Medicare Part A. Now, that is your hospital care. That's when you are in the hospital. It helps pay for your costs while you're in the hospital. Now, the good news is Medicare Part A is usually free as long as you've earned your 40 credits, and that's basically about 10 years of work. And if you've been a stay-at-home mom or dad or whatever, you can file on your spouse's work experience to get those 10 years if you can't qualify on your own. Now, Part A has a $1,736 deductible, and that you must pay whenever you're admitted to the hospital. Now, that is not per year, that's per event. So if you got admitted in March, you'd have to pay it. And if you got admitted, say, in July, you'd have to pay that again. So those are costs that you have to pay. And oddly enough, you have to pay for your first 3 pints of blood. I wish I knew why they charge that. I guess if you have to pay for it, maybe you don't need that and you'll just settle for some plasma. I really don't know. And if you're in there for an extended period of time, you actually could end up paying $868 per day. And if you're in there for more than 150 days, which is very, very unlikely, you don't even have any coverage. So while Medicare Part A is awesome, there are gaps in there that need to be covered, and we'll talk about those a little bit later. So that's your Medicare Part A, which is your hospital care coverage. Now, Medicare Part B, what is that? Well, that's for doctor visits, preventive care, if you want to take a ride in the ambulance. Also covers things like chemotherapy. So if you're diagnosed with cancer, you need to get chemotherapy. That is going to be covered under your Medicare Part B. Now, how do you sign up for your Part B? Well, there's 3 ways. One, if you're currently on Social Security and you're getting payments, they will sign you up automatically. You don't have to do anything. But if you're not drawing your Social Security benefits, you are going to have to sign up online, and I prefer you do that 3 months before just to make sure there's no hiccups along the process and you can get your Medicare. And the Medicare is going to start the month you turn 65. Now, let's say that you've been working and you're 67 years old and you're finally retiring. Well, then you're going to sign up for your Part B during what's known as a special enrollment period, and we'll talk about that later if you fall into that situation. All right, so that's how you sign up for your Medicare Part B. Now, for most folks, Part B premium, standard premium is $202.90 a month. Now, if you make more money, guess what? You know how the government is, the more you make, the more they are going to take. So if you're a high income earner, you will pay more than that. And if that's an issue, you need to visit with us so we can make sure we know exactly what that's going to be, and there are ways that you can get that reduced. We'll talk about that at a later point. Now, the way that Medicare works is before Medicare pays anything, you have to meet a $283 deductible in 2026. And after that, Medicare Part B pays 80% and you pay 20%, which sounds pretty good unless you get a bill from your chemotherapy processing of $100,000, then you've got to pay 20 grand, and we don't want that. So most people, most of our clients, want to take care of that risk, and so what they do is they sign up for a Medigap or a Medicare supplement plan. Now let me just be very clear, a Medigap plan and a Medicare supplement plan are the exact same thing. No difference. Two different terms for the same thing, just to make things a little more confusing. So what does the Medigap plan pay for? Well, it's going to pay the Part A deductible, that's $1,700 and some change. Any copays associated with being in the hospital. It's going to pay your Part B deductible. No, I'm wrong there. Look, I'm going too fast. They're going to pay the 20%, the co-insurance, and you. The only thing you have to pay is the $283 Part B deductible. Now that is what your cost is, and after that, everything's pretty much covered at 100%. Now the two Medicare supplement or Medigap plans that we offer are Plan G and Plan N. Plan G is the most comprehensive. Plan N would be known as the most cost-effective plan. That's another option. So we'll talk about more of those later on down the road. So this is what most of my clients do. And with traditional Medicare, it's also called original Medicare, you can see any doctor, hospital in the country that you want without a referral, as long as they take Medicare. And by law, if they take Medicare, they have to take whatever Medigap plan you have. So it doesn't matter what insurance company it is, they have to take it. And your Medigap plan are provided by companies like Mutual of Omaha, Humana, United Healthcare, Blue Cross, Aetna, and the list goes on and on. So that is what most of my clients do to take care of their Medigap situation. Now, the other thing you got to do is you got to get that dang prescription drug plan. Now, there are currently 12 different plans that you can choose from that range anywhere from zero, believe it or not, to $167 a month. Now, you might say, well, do I need the best? Well, you'd be surprised how many of our clients, most of them only pay nothing, or they pay about $22 a month this year. Now, the only way you really are going to know is we get a list of your prescriptions so we can go to check them out and see which plan will be right for you. And then some people say, well, I don't even take any prescriptions. I'm not going to get one. Well, just get the zero plan, because if you don't get one right now, you're going to have to pay a penalty for the rest of your life, and we don't want you to have to pay a penalty. Now, currently, we are not contracted with any of the prescription drug plans. It's a long story, but we'll still help you find one and help you get enrolled in it. We just can't help you if you ever have any issues with it, because they have booted us all out, and we really appreciate that. But anyway, that's the way life is. All right, so that's what you get. You get that. That's your prescription drug plan, and then you're in pretty good shape. But Medicare doesn't cover everything. What's not covered by Medicare? Well, let me tell you. Long-term care and extended home health care. Now, nobody really wants to talk about this because it's depressing. I get that. But the reality is 70% of us will need some type of long-term care or maybe extended home health care. And the reality is 86, they did a study, AARP did, 86% of seniors want to stay in their home as they grow old. They do not want to go to assisted living. That's my mom and dad right there, and they never had a plan. Dad said, I don't ever need that. Nothing's ever going to happen. I'm just going to die right here on the farm. Well, it didn't work out that way. It's a very long story. Bottom line, we spent a lot of money helping them get into an assisted living home. And I would highly recommend you set up something, because it was very, very hard for us to get that taken care of. So one of the things that we do in our process is show you how, for very little money, you can set up kind of a start of your long-term care plan for very little cost. It's a great home health care plan, so that when you do need some help, there's a plan in place that your kids or your spouse can activate, so it's not so stressful, and we'll talk about that a little bit later. But again, long-term care and extended home health care is not covered under Medicare. Those are all cash paid items if you don't have anything in place. But there are additional coverages. Let's say that you look like this old boy here, and you're going to need a little dental help. There are dental plans if you want to add on the dental plan, because Medicare doesn't cover that. That's available. Also, cancer. Now, wait a minute, Greg. Cancer's got to be covered under Medicare. It is covered. I have seen too many things happen. I've got clients that, while Medicare does cover the medical cost of cancer, there's a lot of associated other costs that you just don't always see. For instance, I've got a client that lives in Marble Falls. He has to drive to Round Rock 4 days a week to get his treatments. Well, he can't do that by himself. Someone has to drive him there and drive him back, and that costs time and money. I've also got people that have to go to MD Anderson. They have to spend the night there. There's cost involved with that. If you get some of these expensive cancer medications, they can cost up to $7,000 a month, and even with the drug plan, you're still out thousands of dollars. So I just recommend, if that's a concern of yours, there are some really good cancer plans. I currently have $20,000 on myself and my wife, because the likelihood is more than I want to admit, because on my side of the family, my dad had cancer, mom and my brother. On my wife's side, her mom, dad, and brother have all died from cancer, and both of her sisters have had breast cancer. So sometimes you just got to look at the obvious, but we have that. That's something you can get at very little cost as an add-on. Again, I'm not trying to spend all of your money in retirement. I just want you to know what the exposures are and how you can take care of them. All right, so those are additional coverages that you can get that Medicare doesn't cover. All right, so here we are, 6 things that you need to do, and that is get your hair cut. You need to get your Medicare Part A, right? We got to have that. We got to have our Medicare Part B, and we got to decide whether we want a Medicare Plan N or G. And then you got to pick your prescription drug plan, which we're going to help you do all that. And we're going to show you how you can start your long-term care planning at very little cost. And then 6, decide if you need any additional coverage like the dental and the cancer coverage. So those are the things that we're going to help you with. Decide what you want to do. Now, I'm just going to let you know, none of this stuff is free. You know, you're already going to be paying $202 for your Part B. You add these other things on, just depending on several things. You're going to be spending anywhere from $350 to maybe $400, just depending on what all you're going to need. So that's what you need to budget, and then we'll get into more details of that as we move through the process. Now, I know there are some people out there that are on a very tight budget, and that may scare them. And that's okay. If you need a lower cost product to help you get covered, and then you're stressing over the $202 a month, then we're probably going to need to look at a Medicare Advantage plan or Medicare Part C. Now, what is this? This is where the government said, oh my gosh, we got all these people turning 65 and they are living forever. Well, they came up with a thing called Medicare Advantage or Medicare Part C, and that's where the government looks at these insurance companies like Aetna, Humana, all of them, and they go, wow, they know how to do this. So why don't we pay them to provide an alternative to original Medicare, and they take all the risk and they provide the benefits. And so these plans, insurance companies don't know how to market these plans. These plans are available. The good thing about them is they're very low cost. Some of them you have a zero premium for. The downside is they're HMOs, some PPOs. There's more managed care. So you just have to be careful of, making sure your doctors and things are in network. So we don't care what you do. We want to make sure whatever you do, you're comfortable with it, it's in your budget, and you're not overpaying for things that you don't necessarily need. All right, so what do we need to do now? Well, the first thing is, if you'll look back on the email that we sent in the middle there's a little form that we need you to complete. And that's part of by law, we got to get you to complete a scope of appointment, which just gives us permission to help you review things. You're not buying anything. And in there, we want to gather some information that's important to us, your home address, especially your medications. And if you're looking at an Advantage plan, we really need to know what doctors and hospitals to make sure they're in network. And anything else you want to tell us. If you like to fish, put it in there. If you know what you already want, tell us in there. The more you put in there, the easier it is for us to get you what you need. And then when you complete that form, whether it's for me or Rochelle, we will get a text. And it says, hey, that form's been completed. So we'll go look at the information, review it, contact you, ask a few questions, and then we're going to put some programs together for you and some pricing, and you tell us what you think you're going to want, and we're going to try to get you the best deal on those. And so we'll review all that and go over it with you, and then you just say, hey, I want this and that, I want that package, and enroll me. And it's just that simple. We can do all this online, over the phone, pretty easy peasy. And we are not here just for a good time. We're here for a long time. So we are going to be available for you for many, many years to review things in the future. All right. Well, that's pretty much it. Done for me. If you have any questions, please give us a call, but get that form completed, submit it to us, and then let us help you transition to Medicare and put a smile on your face. Have a great day.